Awesome. Awesome. Welcome, everyone. It's such a pleasure to have this wonderful discussion with you guys about TDM. It was an amazing session we had the last time, and I'm sure this session is also going to be another amazing session. Okay, so we'll move straight to the meat of today's session. I'm going to share my PowerPoint so we can start right away. So, I'm sure a lot of you are all wondering what the TDM is about, of what we call the secrets of the TDM. All right, so first of all, this is MedCognito. For those of us who are joining us for the first time, this is a preparatory resource that prepares you for Kiwi 1 NAC TDM. Today's topic is focused on TDM. So, secrets to know in TDM exam preparation. Okay, so I'm going to give you an overview of what the therapeutic decision making exam is. So, the purpose of that exam, a pan-Canadian initiative, that means that your TDM exam applies, the results of that exam applies all over Canada. It is not restricted to a province, okay? Previously, it used to be province specific, but now what you have is an exam that is accepted throughout Canada. And unlike the NAC exam that is assessing you at the level of a final year medical student about to start residency, the TDM exam is pegging you at a little higher level. You are not someone or a candidate who is being prepared for training, but someone who is already practicing and is independent. So that is to give you an idea of the level at which the TDM exam is going to assess you at. Now, what is the scope of the TDM exam? It's going to assess your knowledge, specifically your therapeutic knowledge on common cases that present in family practice, the clinical settings in Canadian family practice. And for people who do not, this exam for candidates who have internship in their home countries, have some independent experience. So at the time that you're writing the TDM exam, you are about starting practice as an independent family physician in Canada. The exam is a 3-hour exam. Before you start the exam itself, you will have a 30-minute interaction with the interface. You would have security details as usual, as per for all the MCC exams. And you will have 40 cases within the 3 hours to answer.
Dr. Alex, we can't hear you.
So let me repeat that again. It's a 3-hour exam, and you have 40 cases within the 3 hours. Now, each question may have 2 to 3 sub-questions under them. And the questions are in the form of the clinical vigilance. So there are no multiple choice questions in the TDM exam. There are no multiple choice questions. It's a case, a clinical case, and you have what is like the CDM, let me put it that way, for the Kiwi one, all right? It's comparable to the CDM portion in that you're going to fill in, you're not going to choose, okay? So we approximate a total of about 100 questions for the TDM, give or take, thereabouts. And the next exam dates is January 18th and June 7th of next year. So for candidates whom we are preparing for, they have just a little over 9 weeks, but the schedule that we are running with prepares candidates for 7 weeks, and the remaining weeks is just for revision and interaction, basically. You have 2 options to take the exam. You can go to a prometric center and do it in person, or you can do it from the comfort of your home. That is the remote proctoring option. And this is a point that I emphasize a lot. You have only one attempt for the exam per calendar year. So if you take the exam in January 2022, we are not able to pass for that attempt, you cannot take another TDM session in 2022. You need to wait until 2023. So you get the drift. It's important that you pass on first attempt so that you are not delaying your practice starting time unduly, all right? And also that you have only 4 lifetime attempts. You cannot take the TDM 4 times. If you pass, let's say you fail the first time, you fail again, you cannot take it more than 4 times. Just like the NAC exam, you can't take the NAC exam more than 3 times. All right, so it's just important to take it and pass once and for all. All right. So what topics is the TDM going to, assess you on? You're going to look at, you're going to be assessed on areas such as health promotion and illness prevention. You're going to look at emergency situations, admission orders, when to refer, when to consult. So essentially, this is testing decision making. All right. You're going to be assessed on chronic illnesses, your knowledge on chronic illnesses, the safety profile of medications, drug classes, your knowledge about how to write prescriptions, which are first line order medications, second and third line, adverse effects, for example, your awareness and understanding of complementary and alternative medicine in Canada, herbal medication, etc. Allied practices like physiotherapy, chiropractor services, home care, podiatry, social work, etc. It will test you on things like negotiating a therapeutic contract, specifically opioids, benzos, etc., drug misuse, and also general knowledge on therapeutic options given any medical condition. It's also important that you are able to adhere to the instructions that you are given let me go to the previous slide. All right. So I was touching on the fact that the scope will include areas like awareness and understanding of alternative therapies, negotiating a therapeutic contract, drug misuse, patient advice on various therapeutic options. Okay, this is the scope which will be covered by the exam. All right. Are you hearing me clear now?
Yes.
That's good. All right. So I was touching on this essential point that when you are given a question for the TDM, you need to follow the instructions. You need to know what the question is asking. And typically you may get questions asking about the drug name or say drug dose, or route of administration of a drug, or the frequency. And this is something we always tell and prepare our candidates to know, so that you know the exam technique. Because if the question is asking for a dose and route and name, and you don't specify that, then you lose marks. Okay, so we are going to run through a sample question. So I give you all an idea of how the TDM is like, and how we prepare as MedCognito, how we prepare candidates for the exam. So I'm going to invite someone from the audience to do us the favor of reading the question, the sample question. Can we have someone read the question so you don't hear my monotonous voice? Any volunteer?
A 16-year-old female made an appointment with you because she is worried about her acne. She has noticed significant breakouts with discolorations, nodules, and scars over the last few months, which has been affecting her self-esteem. After trying several over-the-counter remedies without any success, she reports to your office for help.
Right, excellent. Thank you very much, Doctor. Okay, all right. Can we get another volunteer to read through the questions? Anybody to volunteer and read the questions for us?
What your goal therapy for your client? 2, state 3 non-pharmacological measures to alleviate her symptoms. 3, what investigations, if any, will you request for your patient? 4, your patient tells you about her plans to go on a particular diet and avoid some foods in a bid to improve the acne. What will be your response? 1 line. 5, list 3 topical agents and 3 systemic pharmacologic agents from different classes you can use. 6, you notice the scars and nodular lesions. What pharmacological agent would you prescribe at this time? Name only. 7, what baseline lab investigations will you request prior to initiating this treatment? 3 lines. 8, what advice will you give to your patient regarding prescription of this pharmacologic agent? 3 lines.
Awesome. Thank you very much, Doctor. And I apologize that you seem not to hear me at some point. I hope I'm clear and loud now.
Yes, sir. Please move on.
Great. All right. So let's move on. So I want answers for number 1. Okay, maybe I'll go back so that you can see. This is the vignette. Again, you can have a quick glance through it. It's about acne. You have a female patient who has breakouts, excoriations, nodules, and scars, and is coming to your office for help. So what are your goals of therapy for your client? So you see, so typically you will not have this large number of questions. You may have 2 or 3, but for MedCognito, when we prepare candidates, we try to give them a wide scope so that your knowledge is broad, so that wherever the question is aimed at, you definitely will have an idea of what kind of answer to put. And you see some of the questions, I put 1 line, 3 lines, and I put name only. It's to train you so that you know how to approach the question. So please put in goals of therapy. Let me specify, let's say put in 3 goals of therapy for this client. 3 goals of therapy for this client. Let me see. I can see Malika relieve lesions and increase her self-esteem. Good effort there, Malika. Please type your answers. Improve acne. Okay. Any other answers? Feel free, just type in. Let the answers flow. Okay, I see prevent symptoms, reduce symptoms, prevent progression. Okay, clear skin, prevent new lesions. Okay. I see minimize scarring. Awesome effort there. Prevent scars. Okay. All right. Improve self-esteem, decrease severity. All right. Okay, the patient will have her acne reduce in frequency, quantity, and scars. Treat acne, prevent scars, stop recurrence. Okay. Reduce this pigmentation, improve lifestyle. Awesome. Thank you very much for the input. Let's move on to the next question. State 3 non-pharmacological measures to alleviate her symptoms. 3 non-pharmacological measures to alleviate her symptoms. So let's see your input for that. Next question, non-pharmacological. Okay, so I see good skin hygiene. I see avoid astringent, CBT. Interesting answers there. Avoid irritants, use water-based makeup, lifestyle, sleep. Okay. More answers. Non-comedogenic makeup. Right. Non-comedogenic makeup. Wash face twice a day. Medicated face wash. Clean face with water and soap. Don't pick your lesions. Avoid irritants. Okay. Clean face with water and soap. All right. Oil-free makeup. Lower GIT. Diets. Well, this is interesting. We will see what the evidence says about diet. Right. Avoid touching the acne, avoid pressing lesions. Awesome, awesome. Educate the patient about the nature of the disease, avoid scratching the lesions, reduce stress. Interesting. Avoid stress, diet changes, avoid excessive washing of face. Okay, right. Let's move on to number 3. And I'm very interested to see the responses I'll get here. What investigations, if any, will you request for your patient? What investigations, if any, will you request for your patient? Let's see response for question 3. Yes, I see reduce stress, reassurance, and education. I see pregnancy test. None. I see none. I see H. pylori test. I see beta HCG, LH, FSH. None. I see none. Okay, I see none. Liver function test and lipids before starting oral Roactin if indicated. None for now. Okay, all right, interesting. No if polycystic ovarian syndrome. Lipid profile. Polycystic ovaries. Okay. All right. Okay, let's move on to number 4. Your patient tells you about her plans to go on a particular diet and avoid some foods in a bid to improve the acne. What will be your response? And you have 1 line. It's important I state this 1 line because the text on a line will have a specific number of characters. So you need to train yourself to try and give concise and succinct answers, right? You're not going to exceed 20 characters. That's too much. You try to give very concise and succinct answers. All right. So there's no association with diet and acne. Food is not related to it. There is no association. No evidence supports that. So, well, we'll get to that discussion because earlier on, when we were looking at non-pharmacological measures, I saw some answers with, reducing some kinds of diet and all that. There's no evidence. It's a myth. There's no strong evidence of diet and acne. The role of diet is uncertain. Right. Good contributions. Let's move on to question number 5. List 3 topical agents and 3 systemic pharmacological agents from different classes you can use. So 3 topical and 3 systemic, and these should all be from different classes. So maybe you can type in, okay. State whether it's topical or systemic when you are giving your answer. Okay, I see clindamycin, topical T, local clindamycin, benzoyl peroxide. Okay, more answers. Let the answers flow. Topical hydrogen peroxide. Okay. Clindamycin, isotretinoin. Okay. Systemic diane contraceptive. Okay. Salicylic cream. Local retinoids. So it's important to see the question is not asking for classes. The question is asking for agents from different classes. So it's always important to pay particular attention. Sometimes the questions may ask you for the class. Sometimes the question may ask you for the agents, the medications themselves. All right. And it's good to pay attention to the question because you can't give, if you give 2 agents and they belong to the same class, then you lose points for that question, right? So I see retinoids. So retinoids, if you say retinoids, then you are giving a class. You're not giving a medication. Local clindamycin, benzoyl peroxide, retinoids, systemic tetracycline, okay, retinoids, Accutane. And it's also important to note that you are better off giving generic names rather than trade names. All right, just state generic names. I see OCPs, I see Eteritin, okay. All right, good. So let's move on to question 6. Question 6 is saying that you notice the scars and nodular lesions. Now, which pharmacological agent will you prescribe at this time? Name only. So the question is telling you, this question could have been said that, could have been reframed that medication from which class, right, could have been, will be most appropriate to prescribe at this time, or which pharmacological agent will you prescribe? But then in bracket, it will state the class only. All right. So you may have all the knowledge, but if your exam technique is poor, you will not get enough marks to pass the exam. It's important that you pay particular attention to the way the question is framed. Okay. Number 7, what baseline lab investigations? Okay, so let's see the question, the answers for that. So I see Accutane, retinoids. So like I said, retinoids is not a, if you see that it's broad, right? If you say Accutane, you are giving a trade name or a brand name. You're better off going with generics. Okay, all right. So let's move on to number 7. What baseline lab investigations will you request prior to initiating this treatment? And I'm saying 3 lines because sometimes you will have this prompts in the question, 3 lines, or sometimes you may not. For example, the first person says, what are your goals of therapy? Then you are at liberty to state as many as you know, right? And for the TDM, you don't have any negative marking. You want to be safe, but you don't have any negative marking. So as long as your answer is a reasonably safe answer, that is fine, right? Most of the time, the questions will tell you exact number of items that you are expected to know, or it will be implied in the question. All right. So what baseline investigations? Let's see what we have. I see beta HCG, lipid profile, liver enzymes, beta HCG. I see PT, beta HCG, PT lipids, liver function test, beta HCG. So my advice generally, or commenting on that, you are better off saying liver enzymes or even specifying AST or ALT rather than stating liver function test. All right, just to erase any ambiguity. Okay, you are better off stating liver enzymes or specifically AST or ALT rather than saying liver function test. Liver function test is very broad, right? Serum albumin, PT, PTT, they are all components of liver function test. So you're better off being very specific. Right. I see which white blood cells, beta ECG, lipid profile. Again, lipid profile is fine. I would prefer you stating serum cholesterol or triglycerides. Try to be as specific as possible, okay? Because you'll find out that if you visit the MCC website, there are some answers that we think may be correct, but it is not acceptable. It's not acceptable as an answer, all right? Because it's so vague. So you want to be as specific as possible. Okay, so now let's move on to question number 8. What advice will you give to your patient regarding prescription of this pharmacological agent? Again, 3 lines. So 3 lines should give an idea that you are expected to provide 3 answers, right? If it's 1 line, you know that you are expected to provide 1 answer, all right? Okay, so I see double contraceptive, use contraceptive, double contraception, not get pregnant since 6 months, 2 pregnancy tests 4 weeks apart, lipid. Okay, great. Awesome. Thank you very much for your contributions. Okay, so let's review model answers for this. So what are your goals of therapy? If you have someone who comes with very severe acne, what are the goals of therapy for your client? So your goals will be to clear the existing skin lesions that she has. Okay, you want to clear those that she has. You want to prevent new lesions from forming. You want to minimize scarring. You want to reduce dyspigmentation or depigmentation, and you want to minimize psychological impact. Okay, these ideas should be conveyed in the answer that you present. You may write it in different ways, but this should all reflect. All right, so this, you can choose 3 out of any 5 of this, and you should be fine to go. All right, so we move on from goals of therapy, and I want you to pay attention to the order in which the way in which the questions, the range of knowledge that the question is framed and is aimed at targeting. So we have done goals of therapy. Now the next thing is the non-pharmacological measures, right? What non-pharmacological measures will you use for addressing this acne? Okay, now you can utilize gentle skin cleansers rather than soaps or scrubs. Avoid aggressive scrubbing of the skin. Select non-comedogenic skincare and cosmetic products. Avoid picking of acne lesions. Okay, so any of this is acceptable. Also, because the question is for non-pharmacological, things like various lasers, intense pulse light, microderm abrasion, photodynamic therapy, comedone extraction, these are all regarded as non-pharmacological measures. So you'll be marked right if you put any of these down as well. Okay, you cannot state anything that involves medication for that matter. I would prefer that you go with things like avoid picking of the acne lesions, avoid non-comedogenic skincare products, avoid aggressive scrubbing, because those are not expensive, right? And you know, in Canada, when you are providing answers, you need to consider the cost, right? So, I mean, in relation to what you are providing. So I will always say that put this first forward there, because I mean, those who have had experience with laser therapy or photodynamic therapy, we know it's quite expensive. Okay, so we move on to number 3. Let me go to that question, so that it's important to pay attention to the way the questions are worded. All right, it's important to pay attention to. So what investigations, if any, will you request for your patient? So at this time, you are not going to request any investigations at this time. All right, so it's very important. So the answer should be that no investigations are required at this time. Okay, because investigations are not usually required. The diagnosis is a clinical one. Okay, and if you're going to do investigations, it is not for the purpose of diagnosing the condition. It will be the purpose for initiating a certain kind of treatment. And the question will be clear to give you a clue for you to know that, you know, this is why the investigations have to be done. All right, and I'm sure this will come up, this discussion will come up as we move on down the line and attempt the other questions as well. So dietary recommendations, and this is very important. I saw it when we're asking about non-farm measures. People were putting in dietary changes and all that. So there's no evidence to support dietary recommendations at this time. There are no randomized trials that can confirm a beneficial effect, and this is from UpToDate. So, you know, the recommendation is that family physicians refrain from recommending specific dietary changes routinely. That's not what you do routinely. All right. Some associations have been made, but the evidence is not clear. All right. So there's no evidence to support that at this point. Okay. So again, the topical and the systemic. So if you say retinoids, like I mentioned, retinoids is broad. Retinoids will refer to a class, not an agent. So you can go for tretinoin, azathioprine. These belong to topical retinoids, right? If you want to go for topical antibiotics, so that will be the class, and the agent can be topical clindamycin. All right. If you want to say topical alpha hydroxy acids, glycolic acid is an example. Beta hydroxy acid, salicylic acid is an example. Peroxides is a class. Benzoyl peroxide is an agent within that class. Dicarboxylic acid is a class. Azelaic acid is an agent within that class. So it's always important to note, is this person asking for a class, or is this question asking for a medication agent, and so that you give the appropriate answer? Okay, so for the systemic agents, retinoids is also a class, and isotretinoin is a medication agent within that class. Macrolide antibiotics is a class. Erythromycin is a medication agent within that class. Combined oral contraceptives, you can't give combined oral contraceptives as an answer when you're asking, because it's broad. All right. Well, maybe ethinyl estradiol or sperinone. Okay. If the question doesn't ask for the dosage, I just put this there to illustrate. If the question doesn't ask for a dosage, you do not need to provide it. All right. You can just write ethinyl estradiol / drospirenone. Okay. So this is to give you an idea of classes and medication agents, all right? The examples and how to give an appropriate answer. So you cannot you cannot write doxycycline and minocycline because they belong to the same class, and you won't score points because the question asks you different classes, right? So if you are doing systemic, mention systemic agents in different classes. You cannot put two medications that are all in one class. I hope that point is clear. All right, so we'll move on to question number 6. So this is very important because it's very high yield. And what we are discussing here, we are not breaching any MCC confidentiality questions. None of these questions we are discussing here are MCC questions. Like I mentioned to you, the question scope is what is bread and butter of family medicine, right? So as Dr. Bruni would perhaps later throw more light on, he has been practicing for a significant number of years, and acne is something that you should know offhand. So acne is something that you can easily be tested on, all right? So just to give you an idea, they're going to test you on what is routinely coming to the clinic office, okay? So when you have a question like this, and the question hints about scars, the question is hinting about nodular lesions, they are drawing your attention to the fact that this is severe acne. All right? Scars or scarifications, excoriations, all right? Hyperpigmentation, okay? Nodular lesions. All this is drawing your attention to the fact that you are dealing with severe acne. So when you have a question that has this preamble, and the question is saying, which pharmacological agent will you prescribe at this time? You know they are drawing your attention to it. And the only agent that is very effective for severe acne is isotretinoin. All right. There are other effective systemic agents, as you saw in that list, right? But oral isotretinoin is considered the only medication that can permanently alter the natural course of acne vulgaris and has the potential to induce long-term remissions of therapy. And this is from UpToDate, okay? So it's the only very highly effective oral medication. So when you have a preamble and you're asked which medication are you going to choose at this time, your answer is isotretinoin, okay? And I mean, regardless of all the very high, the very toxic profile of it, if this medication is still used, then you must know that its effectiveness is very high. So again, the question was asking baseline investigation. So you see, people were mentioning lab investigations for acne in response to question number 3, which should not be the case. So at that time, there's no preamble. There's nothing in the question that is suggesting that you are going to give isotretinoin. You don't give isotretinoin routinely to all of your acne patients, right? In fact, you start with topical first and even non-pharmacological before you even move on to something like isotretinoin. So that is not, that is just to give you an idea. You need to follow the vignettes in terms of the sequence in which the vignette is progressing, and pay attention to cues that the question is giving you, okay? So, I mean, most of you got this right. You need to do your serum beta HCG. You need to do your AST, ALT, all right? You can also be asked the question, at what point will you stop? For example, at what point will you discontinue isotretinoin? All right, if the levels reach more than 3 times the normal values, okay? And then, of course, you need to do your serum triglycerides and cholesterol. Like I said, lipid profile is fine. I will advise against liver function tests. Better say liver enzymes like AST or ALT, be as specific as possible, all right? And the advice, what advice will you give? I saw people write double contraception. That's okay, but if you could expand it, make it very clear, it's better, okay? Because double contraception, I understand, but just write a short, concise answer to make it very clear to the whoever is marking, okay? So use 2 reliable methods of contraception, all right? That is very important because isotretinoin is highly teratogenic, okay? Use sunscreens. That's an acceptable answer, or avoid direct exposure to the sun because it causes excessive drying of the skin and the lips as well. Report any mood changes or suicidal ideas to your doctor. And this is, like I said, bread and butter family practice. It's something that is routinely family physicians in Canada do. Okay, so this is just to give you an idea of, you won't get this 8 questions under a vignette. No, you might 2 or 3 at most, right? But this is just to give you an idea of some of the things you may be assessed on. Rationale. What is the rationale? What are the goals of therapy? What non-pharmacological measures will you recommend? And what pharmacological agents? And when you get to pharmacological agents, you need to know the classes. After the classes, you need to know the medication agents themselves. Then you need to know the side effects of these medication agents. And then if there are any lab investigations that you have to do for these agents, all right? So this just to give you an idea of the scope of questions that you could be asked. As I mentioned, no negative marks. Read the question carefully. Always give the best possible answer. Leave no question unanswered. We've talked about this. You have questions in 3 hours. So what that comes to is about 1.8 minutes for a question. So you're not supposed to spend more than 2 minutes on a question. Be as brief as possible and concise. Be as specific as possible. Don't go saying thyroid disease. That is very broad. Don't go saying liver function test. Better say liver enzymes, all right? Or AST, ALT, okay? Don't over answer. If the question is asking for 3 questions, don't go listing 5. They may just mark the first 3. And if you are putting your very strong answers later on in the queue, like in number 4 and 5, then you are going to lose marks. So try, give your very best answers, state them in the order that you have conviction, right? 1 answer per line. If you're putting 2 answers on a line, you are losing. And don't provide a range. If they're asking you for the dosage that you would want to give of a medication, don't say 10 to 20 milligrams, you lose marks. If you are saying 10 milligram, you write 10 milligram. If it's 20, you state 20. You don't give a range, all right? You could the actual dose. If you know milligram per kilogram of body weight, you can also do that. If the answer is in a range, any dosage that you give in that acceptable range will be accepted. Spelling errors will not affect your score, but make sure that your answer can easily be understood. Because not one person marks it. It's a test committee. You have a lot of people who mark. They're guided by a script, all right? So you want to make sure that you are conveying the ideas, okay? That's why I was saying double contraception, I understand it, but you are better just saying, writing it out as use 2 reliable contraceptive methods. Make sure that you don't have doubt in the market's mind. So what books do we recommend to our candidates to use for TDM? The Compendium of Therapeutic Choices, CTC, RX Files, Choosing Wisely Canada, of course, up to date. Okay, there are so many other resources as well, but we prioritize these 4 and we supplement with other resources as well. So are you ready? Now the question is, for those of you who are preparing to take the TDM in January, my question to you is, are you ready? And that's an important question that we must all ask ourselves. So Dr. Boni, do you have something for us?
Well, Dr. Alex, I think you've captured virtually everything. I will let you just carry on so that in case someone has a question. Yeah.
Awesome. All right. So there are extra review materials as well. Dr. Boni will be putting some of this in the chat box. The MCC candidate information sheet. There's some information you can get from CPSA websites, and then the BC PRA website as well has some very useful sample questions that we urge all our candidates to have a look at.
Thank you very much